Hey, good afternoon. My name is Chigozirim Izeogu. I'm a vascular neurologist in the Department of Neurology here at McGovern Medical School, and I'm really excited to be able to spend the next hour talking to you all about keeping your brain healthy as you age, as well as answering your questions. So our objectives this afternoon are going to, one, define what brain health is and discuss why it is important. We're also going to learn the signs of normal versus abnormal changes in memory and cognition. And we're going to learn 5 common types of dementia and their hallmark signs and symptoms. We're going to discuss everyday medical problems that lead to cognition and memory problems. And then we're going to review Life Simple 7 and the protective role that sleep and cognitive activity play. And then lastly, because I am a stroke doctor, we are going to memorize, at least try to memorize, the signs and symptoms of stroke, as well as what to do if you or someone you know is experiencing them. So what is brain health and why does it matter? So the human brain is the command center of your nervous system. It enables your thoughts, your memory, your movement, and even your personality and emotions. Your brain is essentially what makes you, you. So whether you're a painter or a mother, a teacher, a doctor, or even a finance whiz, you're all of those things because of your brain. So maintaining a healthy brain throughout your life is really the uppermost goal in pursuing health and longevity. A healthy brain allows you to be present and to experience life and all that it has to offer. So as people age and the risk of acquired neurological disorders go up, the burden of preserving brain health increases. It's therefore vital to understand what brain health is and why it's important. So brain health does not have a standardized definition. The CDC has its version of what they consider brain health. The American Heart Association, American Stroke Association, they have their version. And so after reviewing several different ways of defining exactly what brain health is, I settled on this definition. Brain health refers to how well a person's brain functions across several areas. It is what enables a person to independently perform all activities that the individual wishes to undertake. Aspects of brain health include our cognitive health. Basically, this is how well a person thinks, how they're able to learn new concepts, and how they remember things from a long time ago, maybe from their childhood or their young adult years, to new things that are happening in the news. It also involves our emotional functions, how well you can interpret and respond to emotions, both pleasant and unpleasant. So you can think about someone's emotional IQ or even their social IQ and how they're able to read a room or how they're able to anticipate what will come next. It also involves tactile function, how well you feel and respond to sensations of touch, including pressure or pain or even temperature. So now I want to pivot and talk to you all about what we would call sort of normal versus abnormal. So I titled this part, Doctor, is this normal? So many older adults, they worry about their memory and other thinking abilities as they get older. For example, one might be concerned about taking longer than before to learn new things. Examples would be how to use a new cell phone or other technology, remembering a new name, or how to get back to a new place that you found. Other times, one may forget to do something such as paying a bill that you told yourself that you were going to go back to later. These changes are usually signs of mild forgetfulness, which often is just a normal part of aging. It does not mean that one has a serious memory problem. Other common things that happen as we age would include changes in someone's sleep pattern. So someone may wake up more at nighttime, gradually having decreased vision, or gradually having hearing loss. While gradually decreasing vision and hearing loss can be a point of normal aging, it is something that I would recommend that one at least let your primary care doctor know, because especially for something like vision, as we get older, we can get things like cataracts, we can develop glaucoma, or we can develop macular degeneration. And there are treatments for those things. So while people age, and it's a normal form of aging, there are therapies that have been developed that you all can use if you let your doctor know and they get you to the right specialists. So signs that it may be time to talk to a doctor include asking the same questions over and over again. I'm not talking about once or twice, over and over again. Getting lost in places a person knows well. Places like going to the same church you've been going to for a long time, going to the grocery store that you've been going to for a long time, or getting back home in a home that you've lived in for a while. Having trouble following recipes or directions. Becoming more confused about time, people, and places. These are not one-time or very sporadic occurrences. These are things that you can definitely show that there's a pattern in forgetting these things. Another one that I'd like to highlight is not taking care of oneself. So eating poorly or not eating meals that they're supposed to have eaten, someone who doesn't eat breakfast, or someone who doesn't eat lunch when the food is available to them, not bathing, not doing laundry, or wearing the same things over and over again, or behaving unsafely or not like oneself. Forgetting how to use familiar objects correctly. An example would be someone who forgets how to use a remote control, for instance. They knew how to use it before, but over time, they don't know what it's for, or when they use it inappropriately. Other abnormal things that should be brought to your doctor's attention would include taking a long time to complete tasks, such as getting dressed in the morning. It's not necessarily because you forget the steps on how to get dressed, even that's part of it, but even if it takes you a really long time to button your shirt, if it takes a really long time to tie your shoes, someone who can get ready maybe before in about 20 minutes, now it's taking them upwards of an hour. This is something that should be brought to your doctor's attention. And then frequent falls. As someone ages, they can have falls. You know, you're not as strong as you were before. You may have to walk with a cane. However, if someone is having frequent falls where it's really out of the blue, they're just walking and they fall. This is a reason why you should bring it up to your doctor so that you can get to the specialist that can evaluate you for why you're falling frequently. Okay. So we've established that when someone has something more than regular forgetfulness, what is it? So dementia. Dementia is when we're really moving out of regular forgetfulness to something that's more serious. Dementia is a general term used to describe loss of memory and other mental abilities. It's severe enough to interfere with your daily life. That's really when we've crossed over from things that are more mild to interference with your daily life. And it's caused by physical changes in the brain. And these are changes that we use the term neurodegenerative, which means that we don't have a cure for it and it will progress over time. Dementia symptoms vary depending on the cause of the dementia. Here's a graphic that we can look at to review the 5 common types of dementia. So the first one that we'll talk about is Alzheimer's disease. It is one of the most common, it actually is the most common form of a neurodegenerative dementia. And it's caused by abnormal shrinkage of the brain that affects your functions. People can have behavioral changes, they can have problems in their relationships, and then they also are forgetful. They have problems learning new things like we discussed. When someone has dementia, especially Alzheimer's type dementia, in the beginning, they may be the only ones that are aware that there's something that's wrong. Meaning that if you're experiencing these symptoms, people on the outside don't know it, but you know it as a person. At that point, you may find where someone's writing notes to themselves, or you're having to write notes to yourself very frequently in order to remember things about your daily life. So appointments, where you left something, what you're supposed to be doing. As it progresses, it gets to the point where people around them, friends, family, notice that someone is a little bit more forgetful. As a person with dementia gets worse, it gets to the point where even they are not aware that they have problems with memory or thinking. At that point, it's imperative that the people around are present to make sure that a person is able to keep themselves safe. And so those are kind of the major stages as someone goes through dementia, specifically the Alzheimer's type. The next type of dementia that I want to discuss is dementia with Lewy bodies. So this dementia is a dementia that is almost like a combination of someone with maybe Parkinsonism that you would see in Parkinson's disease, as well as Alzheimer's or typical dementia like what we know. Sometimes they can have problems with sleeping. They may act out their dreams. So let's say your bed partner complains, "Oh, you hit me last night," or, you were having a dream and it was like you were trying to ride a bicycle, or you were lighting a cigarette and smoking it in your sleep. We don't want you smoking. That's just an example. So whenever someone starts acting out their dreams, having very vivid dreams, or having visual hallucinations that are not disturbing, these are all signs that perhaps they can have a Lewy body dementia. The third type of dementia that I want to talk about is vascular dementia. An old term or another term that we can use to describe this is a multi-infarct dementia or post-stroke dementia. So we'll talk about strokes a little bit further, but basically this type of dementia is a dementia that can happen, and then it kind of seems that someone stabilizes. They don't continue to gradually progress, meaning they're not losing skills gradually over time. They have an insult, which is like a stroke, and then they plateau. But then they can have another insult. It's what we like to describe as almost a stair-step progression, like walking down the stairs. If you control the risk factors and you can try to prevent further strokes, this is a type of dementia that actually can be intervened upon. There are other types of dementia related to stroke, specifically a post-stroke dementia that someone can experience. So if you or a loved one or someone that you know has experienced a stroke, then after they've had their stroke, they may realize that they have difficulty thinking, or they might be a little bit more forgetful. This is not something that might be immediately present when they're in the hospital, when they're having their stroke, but it's something that can occur thereafter. So that's another form of vascular dementia. The fourth type of common dementia that I'd like to talk about is frontotemporal dementia. So this dementia is really characterized by behavioral disturbance. This is a type of dementia where someone really is not acting like themselves. A good example would be someone who didn't use foul language, someone who was a very calm spirit, but now they're ready to get in a fight with everybody. Someone who stops taking care of themselves, so they stop showering or they stop going out. It's quite alarming to other people around them. For instance, if your spouse just completely turns into someone else by their behavior, this is something to bring up to your doctor. Other things that you could see would be, let's say, anxiety. Someone who previously has not had a difficulty with anxiety or anxious thoughts, and then all of a sudden, they gradually start having really anxious thoughts, and it's limiting. And this is in a person who previously was never like this. These are all signs and symptoms of a frontotemporal dementia. And then a person can have a mixed form of dementia where, let's say, they have Alzheimer's type dementia, but then they also have vascular risk factors and they have strokes. And so that could be a combined type of dementia. The reason why it's so important to let your doctor know, beginning even with your primary care provider, is because now there are treatments that are available. It doesn't cure, there's no treatment that's curative for dementias, but there are treatments that can help slow down the progression of dementia. Okay. Other common neurological disorders that I wanted to talk about include idiopathic Parkinson's disease. So a person that's presenting with a tremor. So when they put their hands down or they're just relaxing, you may notice that their thumb is moving or their hand is moving. That's a hallmark sign. Having difficulty walking, someone presenting with frequent falls, someone who takes a longer time to get ready, someone who you've noticed doesn't have an expressive face. So when you're talking to them, they kind of have this flat look on their face. They're not really smiling. They don't really blink very much. These are common symptoms that a person can have when they're showing signs of idiopathic Parkinson's disease. There are also several other neurological disorders that can present like Parkinson's. They're much more rare, but if you notice that you or someone that you know is exhibiting these symptoms, these are reasons to reach out to a healthcare provider. Restless leg syndrome is something that someone can get as well as they get older. Sometimes midlife, they may develop this. And that's essentially when you're lying down in a bed or you're resting. It doesn't have to be at nighttime when you're going to bed, but basically it's when you're just at rest, you're not moving, you're not activating your muscles, and this sensation comes over you where you feel like you need to just move. And it's hard to describe based on what I've read. I don't experience it, but it's essentially a sensation where I just feel like I just need to, twist my foot or move my leg. And once I do that, I feel better. A lot of times people describe it as something that they experience when they are lying down before they fall asleep at night. Not typically something that will wake you up out of your sleep, but just something that whenever you're at rest, you'll notice it. The essential tremor, that's another movement neurological disorder that a person can develop as they get older, midlife to later. Sometimes it can run in families. And then this is essentially something that you will experience when you're actually doing an activity. So if you're trying to write, if you're trying to drink your coffee, if you're reaching for something, you might then see that your hand is shaking. Some people notice that when they drink alcohol, it makes the symptoms get better. Not saying to treat essential tremor with alcohol, but these are some characteristics that a person with essential tremor may experience. Cerebral amyloid angiopathy, that's a long term, but essentially this is a process where the blood vessels in your head have a protein that goes into the wall, and this can predispose a person for stroke. Sometimes people can have memory issues that are also associated with this disorder. And then amyotrophic lateral sclerosis, or ALS, or Lou Gehrig's disease. Obviously, this is having muscle weakness, muscle wasting, and sometimes people will see a muscle on their body sort of twitching. It's not because you're doing anything to it, it just happens spontaneously. And when you see your doctor, a neurologist would be able to observe for it or make it come out. So now we're going to switch gears a little bit. We've had a little introduction about just brain health. What is it? What are some abnormal signs to reach out to your doctor about? And we've talked about dementias and a little bit about other neurological diseases that one may experience when they're older. But one thing I want to talk about is the risk factors. So common everyday problems that many people have, but that have a real responsibility for creating some of these issues that we experience when we get older, especially the dementias and things like strokes. Okay. So yes, high blood pressure is the boogeyman. Traditional vascular risk factors are highly important, not only for your cardiac health, so like preventing heart attacks and heart failure and other forms of heart disease, as well as strokes, but vascular risk factors are important for brain health as well. I put hypertension or high blood pressure right at the top because it is responsible for probably almost 80% of strokes that we see. High cholesterol, diabetes, they are also risk factors that cause increased inflammation. It causes injury to your blood vessels, and it can damage other structures in your brain that you need to maintain adequate brain health. In addition to these vascular risk factors, it's important to refrain from smoking, get enough sleep, and exercise. These lifestyle factors are very important in terms of preventing these other diseases, such as the high blood pressure, hypertension, diabetes, and cholesterol. One thing that I put on there that we're learning more information about is obstructive sleep apnea. So if you or a loved one experiences increased daytime sleepiness, waking up with a morning headache, waking up with dry mouth, snoring very loudly where it could be bothersome to other people, or someone who, when they're asleep, they're having pauses in their breathing. These are all signs for obstructive sleep apnea. And obstructive sleep apnea has been associated with increased risk of heart disease and stroke. So, what can a person do to protect themselves? Okay. So there's a growing body of scientific research that suggests that the following certain types of steps are linked to good brain health. And if you make small changes, they can really add up. We should all try to make these things part of our daily routine because it can really help one function better. So things that we can do to be kind to ourselves would be, one, taking care of your physical health. And I would say to be able to do that, it would be important to get a regular doctor, a primary care doctor, because there are some of these risks that we would never know we had unless they were checked for. They are silent. So something like high blood pressure or diabetes or high cholesterol, or even sleep apnea. They are not things that you know that they're present until they become quite advanced. And so by maintaining a regular doctor, you can have someone who will screen for all of these things as part of your yearly physical. Managing your high blood pressure. So this is very important. The number that I want everyone to remember is less than 130/80. That is the blood pressure that divides those with hypertension from those who don't have hypertension. Ideally, if you could be 120/80 or less, that would be good. Maintaining a regular doctor and keeping it in your mind that 130/80 is the number is important. So that when you do see your doctor, then you can talk about it. For people who do have high blood pressure already, it's important for us to have a home blood pressure kit. Studies have shown that for people with high blood pressure who monitor their blood pressure at home, and it doesn't have to be every single day, especially if you haven't had any strokes or heart attacks, but at least 3 times a week, I would check my blood pressure with a blood pressure cuff to ensure that you're at goal. Write down the blood pressure, the time of day that you took the blood pressure reading, as well as what your heart rate is. When you go see your regular doctor, bring the recordings to your doctor so that they can help manage your medications. The next thing would be eat healthy foods. We'll talk a little bit about it in greater detail on the next slide, but essentially it's maintaining a healthy diet, a diet that is rich in fruits and vegetables and low in saturated fats, being physically active, keeping your mind active. And we'll talk a little bit more about these other things on the next slides, staying connected with social activities, managing stress. So some examples of this would be something like mindfulness or yoga, meditation, deep breathing, journaling. For some people, it's religion and spirituality, but defining for oneself the method that they feel the best to use to try to manage daily stress. And then overall, reduce your risk to cognitive health, poor cognitive health, okay? So this is the slide that I want to talk about in greater detail. And this slide is a slide from American Heart Association's, and it talks about life's simple 7. So these are the 7 activities that they've studied, and they show that really these are the key things that we have to do. It's easy to say, sometimes it's difficult to make the changes, but it is really and truly worth it because these things help to preserve your brain health, prevent you from having strokes, prevent you from having heart attacks, and can help prevent memory loss and poor cognition as we age. So reducing blood sugar, that's basically preventing you from getting diabetes, okay? About 21 million American adults diagnosed diabetes. Going to see the regular doctor and managing your blood sugar if you do have diabetes are important. Controlling your cholesterol. So high blood pressure and being overweight and eating unhealthy diet can cause someone to have higher than normal cholesterol. There are medications that are there that help bring down a person's cholesterol. These medications have been studied and they are very, very effective in bringing down one's cholesterol. Examples of these medications would be something like atorvastatin or rosuvastatin, pravastatin. Some people have some symptoms or may be concerned about having muscle aches and pains. There are vitamins that your doctor can actually refer you to that can help you with those symptoms. I urge you all that if you have high cholesterol and you might be concerned about a side effect, or you may have a little muscle ache and pain, talk to your doctor about it. And there are vitamins that you can take along with it so that you can take the medication and get the benefit. As a vascular neurologist, as a doctor who specializes in cardiovascular health, I am very aware of some of the symptoms that certain patients have, and there are things that can be done about it. And so you can talk to your doctor about it and get suggestions, but I would try to stay on the medication if you can. You can change to a different medicine. You can change to a lower dose. You can do every other day dosing. And then you can also add vitamins to it to try to keep the cholesterol down. This is one area that I know that the medications that we currently have on the market work really well. Managing your blood pressure, like I said, monitoring your blood pressure with a home blood pressure kit, communicating with your doctor what your blood pressures are running at home, and taking your medication. If you're having any side effects from the medicine, please reach out to your doctor. We can put you on a different medication, and we can also change the way in which the medication is dosed to help deal with any side effects that you might be having. Smoking. If you're smoking, your doctor can help you quit smoking. There are medications that help someone deal with maybe some of the anxiety or some of the changes that one experiences when they stop smoking. Your doctor can help you, and it goes beyond using patches. Yes, there are patches. Yes, there's gum, but there's also medication that we can provide to help you kick the cigarettes. Get moving. So 150 minutes a week. That is the recommended amount of physical activity that the American Heart Association, American Stroke Association recommends to try to prevent cardiovascular events and to keep your brain healthy. 150 minutes of moderate intensity means that if you're taking a walk or a jog with someone, you are not able to have a regular conversation like what I'm doing right now. You don't have to run, but you can walk brisk enough that you're not able to just walk along and talk like I'm talking right now. It's also good and important to put a little bit of strength training exercise to that. So whether that's jogging or walking briskly or swimming in a swimming pool for those of us who may have aches and pains, may have arthritis, then swimming or doing water aerobics can be very helpful because that helps to relieve some of the pressure that is on the joint so that you're able to make it through. I always tell my patients, hey, if you like walking, 30 minutes, 5 days a week, just go on a walk. And you can start from there. And you don't have to do it all at once. You can build up to it. Losing weight. So having an adequate weight is important. I guarantee if you're eating right and you're getting physical activity, those are the right steps. For people who are still having difficulty and you're doing all these other things, this would be a reason to reach out to your doctor. One, to make sure that there's not something else underlying that's making it difficult to lose the weight, but then to also help you in any way that they can for any of the medications that we may have on the market. And then eating right. So the type of diet that has been proven to help would be the Mediterranean diet. So this is a diet that is high in fruits and vegetables. Basically, when you think about a grocery store, there's the middle of the store and there's everything outside. Shopping outside the middle of the store, you're basically going to get the items that will help you have the most healthy diet that you can get. We want a diet high in fruits and vegetables. You can eat pasta, you can eat bread, you can eat rice, but the only caveat is that we recommend that you eat whole grain. So eat whole grain pasta, eat whole grain bread. You don't have to limit yourself or completely cut it out of your diet. We just want you to pick a whole grain option instead. In terms of our meats, poultry, and seafood, seafood is the best, followed by poultry, and then least right on the bottom of that list would be red meats. We'd like you to get red meat sparingly. I'm not saying you can't have a hamburger or a steak. I'm just saying that perhaps having it once a month or, once every 2 weeks is okay. But limiting the red meat that we eat, and then increasing our seafood and eating poultry, lean poultry. So not fried chicken, not fried catfish, but keeping in mind that we want to limit our exposure to fats and increase our fruits and our vegetables. For those of us who may have something like diabetes, then or high blood pressure, there are other medication, I misspoke, other diet recommendations that your doctor can talk with you about, okay? And there's always education. So meaning that if you want to talk about these things in greater detail about what is the right diet for you based on the medical issues you have, then getting information, some offices may have a dietitian, diabetes educator that can talk to you about your diet that is specific to you. Okay. Now, talking about cognitive activity. So there are specific activities that have been shown to be helpful in terms of maintaining someone's cognition and maintaining a good memory. Essentially, you want to do things that help you follow a daily routine. You want to do things that will help you keep track and order of your life. Specific activities that are helpful would be doing things like jigsaw puzzles, right? Playing cards, different types of cards. I'm not talking about, solitaire necessarily, but, playing spades, playing poker, building your vocabulary, playing Scrabble, just learning new words, doing Sudoku, dancing, actually, learning a new style of dancing. So, you can obviously do, if you ballroom dance, learn, salsa, learn merengue. Learning a new dancing style has actually been shown to help with cognition. Using your senses, all of your senses. So whether that's, going to a botanical garden and smelling flowers, or, going to, the spa and just having experience with their hydrotherapy. These are things that can help you with your cognition. And then learning a new skill, something that you haven't previously learned how to do. Research it, try it out. Okay, so now I'm gonna shift again and we're gonna talk about stroke. I'm a stroke doctor, have to talk to you all about stroke. So basically there are two types of stroke that we're gonna focus on. I want you all to remember there's a blood clot stroke and then there's a bleeding stroke or hemorrhagic stroke. And so either one of these types of strokes can present with very similar symptoms. So I want us to go over the symptoms of stroke. And I'm using this acronym called BFAST. These are the signs and symptoms of stroke that allows you to spot a stroke, and it'll also tell you what to do about it. So the B stands for balance, or basically in this case, loss of balance. This is, okay, you're having to walk, but you have to grab onto furniture. You have to grab onto the wall. You feel so off balance that you're concerned you might fall. Related to balance might be vertigo. So vertigo just basically means that you have this sensation that either you're moving or you're spinning in around, or the room is spinning around you, but you're not moving. This is a stroke sign or symptom. Next would be E, eyesight. So if you cannot see well out of both of your eyes, so this also includes double vision. When you're looking at something, you see two objects. They might be next to each other. They might be on top of each other, They might be touching each other, but you know that it's not one uniform object. Another example of eyesight problems would be if you're not able to see out of one eye, meaning that, oh goodness, I can't see on the right side. So you close one eye and you can see perfectly, but then when you close the other eye, you're not able to see anything, or when you're looking, you're only seeing the top or the bottom. Or when you're looking straight ahead, you don't see anything on your right, or you don't see anything on your left when you're looking out of both eyes or just one. The F stands for a facial droop. So drooping out of one side of the face, or another sign that a person might have a facial droop would be if someone may be drooling, or when you're eating your food, you feel that your food, it's hard to control the food on that side of your mouth. These are signs of having a facial droop. The A stands for arm. So arm weakness. And I like to throw in numbness in here as well. So any kind of arm weakness, your hand it doesn't have to be your whole arm. It could be your hand. It could be that you picked up your keys and all of a sudden you're dropping it. You can't pick it up. You can't make as tight of a fist as you previously could. S is speech problems. So either when someone is speaking, it's slurred, like their tongue is heavy, or maybe, goodness, is this person drunk? I can barely make out what you're saying. Or when they speak, it doesn't make any sense. So they're saying words, but you don't even know what they're saying. It makes no sense at all. If you also are with a person and all of a sudden they can't talk, or you notice that they're talking and they're not really using as many words as you know what they're capable of using, that could be a sign of stroke. The T stands for time. It's time to call 911. Don't get in the car and drive to the ER. Don't finish watching the game. Don't finish doing what you're doing. Just call 911. Texas is a wonderful state because there are systems in place that will help you or your loved one get to the right hospital that can treat them as quickly as possible. And today, it is very important to make it to the hospital as quickly as possible because there are treatments for stroke that can help reverse or prevent further worsening. And so, pivoting from stroke, I'm going to reiterate what stroke prevention entails. So our risk factors for stroke: high blood pressure, high cholesterol, being overweight, not getting enough exercise, having sleep apnea that's not treated. For those of us who know we have sleep apnea already, wear your CPAP. Heavy alcohol use. So that in general, I would say more than 2 drinks in a sitting, smoking or drug use, diabetes, or having other cardiovascular diseases that may predispose someone to stroke. The number one I'm going to talk about for cardiovascular disease is atrial fibrillation. So having atrial fibrillation, but not being on adequate medication to prevent you from stroke. So if you've had AFib, or you have a history of AFib, or you feel that you can feel your heart beat, or you feel fluttering in your chest, or you wear an Apple Watch and your heart rate is all over the place, sometimes it's low, sometimes it's high, frequently, these are all things to bring up to your doctor because they're important for stroke prevention. For further information on health and aging, you can look to the www.nia.nih.gov. This is the National Institute for Aging. They have many topics about the topic we just spoke about today, about stroke, about other things related to aging that we're not even speaking about now. If you want further information about anything we talked about or other topics related to aging, this is a wonderful website to look at, take a picture of it, and you can visit it after our talk today. I'm a neurologist. I work at UTHealth Houston Neurosciences. This is our phone number and our email address and our website. If you or someone that you know is experiencing any of some of these symptoms that I talked about today, or you would just like more information, please feel free to reach out and let us know how we can help, because we are eager to help our community. Okay, so this is the end of my talk. I'm ready to take questions.
Okay, so Elise had to run out, so I'm just going to handle the questions. I'm Will, by the way. Let me turn my video on so you can see me here too. We got a couple of questions that were emailed in earlier. Some of them you've addressed, but I'll just read them out to you. And if you want to talk any further about them, please do. One person asked, how much should I exercise after 70? I'm 68 now. I work in the garden when it's not too hot and walk about 30 minutes per day. I think you said that there's a magic number there.
Sorry, yes, that is. If you're walking 30 minutes a day, you're already doing all that you need to do and more. So 150 minutes, that's the number to remember, 150. And I do want to add 150 minutes per week. Thank you.
Per week,
yes.
okay, there you go.
Per week, not per day, per week. 150 minutes per week. And it's not, studies have shown that you don't have to do an hour or 30 minutes. You can do 15-minute increments. You can do 10-minute increments throughout the day. But the magic number is 150 minutes per week.
Perfect. Okay. And then someone in the chat did ask, and I believe you mentioned you were discussing the Mediterranean diet, but when you were talking about prevention, was that the diet that you went into, was a Mediterranean diet?
Yes, yes, okay. It's a Mediterranean style diet. Mm-hmm.
Perfect.
And they have apps and everything. There are apps that are available on your phone to be able to help you stick with a particular diet with suggestions and recipes and everything.
Okay, great. And then another person asked something else you mentioned was, what do you recommend to help get better sleep as I get older?
Nice. So I always recommend good sleep hygiene in general. So good sleep hygiene would include things like not doing work in your bedroom, or as you get closer to the time that you're going to go to bed, begin sort of dialing down. Don't watch the news in the bed. Don't watch the news or, really engage in very stimulating activity before bedtime. You really want to prepare your mind so that your body will start anticipating bedtime and that you're going to sleep. Sometimes people like to use things like, white noise machines, keeping it cool in the room. These are things that can help to promote sleep at night. One of the things that I like to say is that if a person wakes up at night, don't lay in the bed, get up out of the bed, leave your bedroom, go do something, and then come back and lay back down. Don't lay in bed just waiting to fall back asleep, but actually get out of the bed, go and do something outside of the room, and then come back and have your room, as best as you can, be your sanctuary, so that when you're in the room, your body and your mind already knows that this is what this place is for.
Okay. And then we've gotten a couple questions about the presentation. So just to address that real quick, this is not for you. Elena will make available to all of the folks who are at the Y video presentation of this, just a video recording so you can watch this again. We will also take this and post this to YouTube so you can see this later as well. So the video will be there. The slides will not be available to you guys. Sorry if there's any confusion about that, but the video will be there, and obviously the video has the slides. Let me go back into, and then someone kind of running with this sleeping question. Are naps okay as you get older? And if so, about how long is a healthy nap?
So you can nap when you're older. I will I will say this as a caveat. If you're noticing that you fall asleep very easily, like not when you're intending to fall asleep, so like watching TV, reading something in the car, that might be a sign that you have sleep apnea. And so it's okay if it's a dedicated nap, maybe you want to rest for 30 minutes. But if you are, if it's something where you're falling asleep, not when you're intending to fall asleep, or you feel that you have to take a nap, then I would bring it up to my regular doctor, because as adults, we shouldn't really require a nap to make it through the day.
Okay. And then one more spinoff question for related to sleep. Sometimes I'm very hungry before I go to sleep. What can I eat that will not inhibit getting to sleep?
One, I'd like to ask, I don't know what time this person goes to sleep, but obviously not having dinner too early in the evening may try to prevent some of that. I wouldn't necessarily recommend having a really big meal right before going to sleep. But if let's say your bedtime is 10 o'clock and you want to have dinner around 6:30 or 7, I would eat nutrient-rich foods. So not a lot of, fried foods, but maybe like something brown rice, grilled chicken, vegetables. But nutrient-rich foods typically are going to be the ones that prevent a person from getting hungry quickly.
Okay, great. And then something related to back to diet, since that's where's the last question brought us. Any comments on the whole foods plant-based diet?
Yeah, no, this is it's a very good diet to follow. I don't think that a person who cuts out meat from their diet will actually lose anything. You do just want to make sure that you're getting a very balanced diet. Sometimes, it might be good to supplement that with a multivitamin. But if you are following a plant-based diet, that is a good diet as well to follow.
Okay. And then and we have a question that just happened to be there for vitamins. Which vitamins help with cholesterol?
Yeah, so it's always good. The vitamins that are generally good for cholesterol and other health would be, taking a B vitamin, and any general multivitamin will give you all of the vitamins that you need. There are some vitamins that if you take too much of them, they can have adverse effects. So we generally just recommend a multivitamin, a daily multivitamin will give you all of the vitamins that you need.
Okay, great. And then what are the early symptoms of essential tremor?
Okay, so essentially it's any kind of movement, shaking that someone gets with activity. It's not movement or tremor at still, it's typically with movement. So it might start off where someone just notices it when they're writing, but as it progresses, then you're going to start to experience tremor when you're doing things that are not as fine. So in the beginning, more fine motor tasks, they might come out. As it progresses, then you'll start seeing it maybe when you're eating, maybe when you're drinking, but just maybe when you're writing, you might notice it a little bit in the beginning. Okay.
And then a question about daily aspirin. Is prescription daily aspirin, I guess, yeah, that's what they wrote, for chest pain, also good prevention for stroke?
So a lot of that depends on what other health problems that you have. It's something that your primary care doctor would have to answer.
Okay.
That's it. Mm-hmm.
Okay, and then someone posted in the chat that they're doing a daily 1 hour, making me feel super lazy, daily 1 hour yoga and daily 1 hour senior fitness class at 73 years old. Is this too much exercise?
So as long as it's exercise that's being done safely, that's fine. It's not, We basically have a threshold that we want a person to get to, and that's the 150 minutes per week. If you're someone who engages in more than that, and based on all of your health needs and if any other illnesses that you may have, as long as you're safely doing it, then that should be okay.
And then one last emailed question was about basically like what kind of puzzles and games do you recommend to kind of keep the brain sharp? And you went over some of that. I think you said Sudoku and
Sudoku,
crossword.
Scrabble, playing cards is a big one.
Okay.
And there are websites online, several different ones that have games that one can play that challenge the mind. Basically, you want to challenge your mind to think.
And then so sort of like social interactions, is there an amount, like I know you mentioned that there's a target amount of time for exercise. Is there a target amount of time for social time as you get older too?
Yeah, so there's not actually a specific amount of time that you should get. But as people get older, they can sometimes become a little bit more isolated. And so in general, we just recommend trying to maintain social connections and interactions with other people instead of, obviously kind of being a little bit more reclusive into oneself. I think that obviously the Y offers different activities and programs. And I'm happy to suggest that I suggest to a lot of my patients that find your local Y. I tell them, look for water aerobics, look for other programs that are there, dancing. One, it's good just to have community, but then it also helps physically with our mind and our thinking.
Yeah. I think after this presentation, Elena is going to need to figure out a way to do some virtual dance classes. And then we have someone mentioned, kind of going off of what we're talking about, I read a study that Sudoku and crosswords don't really help with avoiding dementia and cognitive loss, but that you instead need to be learning something new. Is that true?
Mm-hmm. Yeah, so it's basically challenging your mind to think in general. It doesn't have to be Sudoku and crossword puzzles, but it's thinking and learning. My suggestion would probably be something like Scrabble, the vocabulary, and learning something new, because there's a learning process that's going through there. Mm-hmm.
Okay, great. Well, that appears to be all of the questions that we have. So thank you so much for a great presentation. Elena, do you have anything to add?
I do have a couple of comments. And Rob Landis, I know that we'll get to your question. I'm going to do that separately at a different time. But what I want to say is that this was great. And it was such information that was unbelievable. And we had high attendance. And again, I feel like you put in the biggest plug for the YMCA. And I will say that that is our mantra. That is our goal. We provide not only the physical education, but we do provide the social outlets. We do provide the opportunity for our members to be able to engage in all walks of life, in all things, to keep going and to be part of it. So this was great in all realms. And I thank you, William. And again, Dr. Izeogu, thank you so much for a wonderful presentation. I'll be sending this out to everybody. It will stimulate us, and I'm so proud of you, and go YMCA for the support. Thank you to UTHealth Houston Neuroscience, and everybody have a great day. Bye-bye now.
Bye-bye.
Thank you.